Welcome to the DjamgaMind USA series. I'm your host, Etienne Newman. Today we are decoding the CMS interoperability and prior authorization final rule, better known as CMS 0057F. This is an 847-page mandate that fundamentally changes how fast you must move. If you are a payer or provider, the days of unlimited review time are over. You are now on a 72-hour clock for expedited requests, and you must report your denial rates publicly.
Right. That's not just fine print. That's a signal that every single major player, from the big insurers down to small provider groups, knows this is going to fundamentally change how they work.
So what's our mission today?
I think our mission is to unpack how CMS is essentially dragging health administration out of the fax machine era. We're looking at how these rules hit four big targets at once: boosting data exchange, streamlining that awful prior authorization process, cutting down on provider burnout, and, at the end of the day, helping patients get care on time.
Okay, so we've got data to the provider, data between payers. The last API tackles the biggest headache of all: prior authorization.
The administrative monster. Yeah, this API is meant to be the automation engine for the whole process. It lets a provider's own system, their EHR, first check if a PA is even needed for something.
So no more logging into a dozen different payer portals.
That's the goal. The provider's EHR can query the payer system, see the requirements, and if a PA is needed, it can automatically package up the clinical notes and submit it. The payer has to publish a machine-readable list of everything that needs a PA.
And the API handles the whole conversation, back and forth.
The whole thing. A HIPAA-compliant request and response.
That transparency push continues with public reporting too.
It does. Starting in 2026, payers have to publicly post a whole bunch of metrics about their PA process every year.
What kind of metrics?
A full list of everything that requires a PA, for starters. Then, the percentages of requests that were approved, denied, or approved after an appeal. And my favorite, the average and median time it took them to make a decision.
So you can actually compare plans based on how efficient they are.
That's the idea. It creates market pressure. No insurer wants to be the one publishing a 20-day median wait time when their competitor is at 5. It should drive real performance improvement.